think Marissa is joining.
Yep, I'm here now.
Go ahead, Marissa, and please introduce.
Okay, good. All right. Yeah, it's a pleasure to introduce Sandy. I consider her a friend. So Sandy went to medical school at the University of Mississippi, where she trained in pediatrics, adolescent medicine, and addiction medicine. She's been at UAB for 26 years, and she found the addiction recovery program with many healthcare professionals in substance use disorders. That's when she became interested in professional health and well-being. She's joined the Alabama Physician Wellness Committee in 2006 to promote health and recovery for Alabama physicians. Also, she established a professional development office 14 years ago. Since that time, she's been taking care of us. So in 2011, Sandy was promoted to Assistant Dean of Professional Development and has expanded her services to include conflict management and assessing dysfunctional teams. So we're very thankful that you accepted to talk to us today, Sandy, about professionalism in medicine. Thank you.
Well, thank you all for having me. And again, you know, I really enjoy giving talks, but it's such a challenge when you can't see your audience very well and you don't know if they're asleep or they're watching you, or so I'm going to do my best, and I won't keep you guys very long, but I'm really happy to be here. And you know, I'm a primary care physician, and like Marissa said, been at UAB 26 years, but the last 14 years I've been focused on caring for people that take care of our patients or that are doing research to help our patients. And so it's been such a privilege and honor to just be available. And I'll give you my contact information, but my job here is just to be a resource to faculty and residents and medical students, to be of help in any way. I have a counselor that works with me as well, and so we do counseling, I do coaching, just anything that can be helpful to people that are trying to work in this profession. We want to be there for you. So anybody that's interested in what we do or just seeing if there's something we can help with, please reach out to me. So today I wanted to talk about kind of professionalism and civility. And so when you think about it, let's see, yeah. So how many of us have either said these words or heard them? Oh, he or she, they don't have good bedside manners, but they're a great doctor. You know, that's the person you would want if you had this issue. Well, we kind of need to challenge that, because is that really a great doctor? Somebody that doesn't have good bedside manners, and that basically we're saying they don't communicate very well, they might not be very nice, but they're really great doctors. And we can't really accept that anymore, because professionalism is not an option, it's a competency. So we need to kind of start realizing that we need to promote that. So what's in it for me are the objectives. We'll kind of look briefly at how the themes of professionalism and the core values align. And then I've just thrown in some strategies I've used for assertive communication and some conflict management, and you know, how to give and receive feedback. So again, I went to the School of Hard Knocks. I've made a lot of mistakes. I've done a lot of coaching. And so this is just some things I've tried to throw together that at least I hope is practical and maybe useful for you all. So professionalism is, of course, hard to really define. And I like this idea of breaking it into themes. So when you look at these 4 themes: adherence to ethical principles, well, basically that's your honesty, your integrity, just the ethical aspects, you know, putting the patient first. And then you've got reliability and accountability. You know, are you dependable? Do you show up when you're supposed to? Do you get your work done? Do you hold other people accountable? And then effective interactions with others and commitment to continuous improvement. Those are the two that I'm going to focus more on today, because that's at least what I see more of in my office. So when you look at our UAB medicine, we have a code of professional behavior that all of us sign, that we acknowledge like every couple of years when we get credentialed. And whether we've read it or not is a different story, but it kind of outlines, just like most codes of conduct, here's the things that are expected, here's the behaviors, and here's the behaviors that are not acceptable. And so I encourage you to read through that if you have, and it's pretty inclusive. But whoever came up with the UAB core values, they're so simple, but they're profound. And I think that the core values really speak to those themes of professionalism. Just do right, do the right thing, work together. That's effective interactions with others. Own it, be accountable, and always care. And that, to me, just distills it down. And that also includes civility, because civility is, and the only reason I added that is just because you're doing the right thing for other people. And I like this definition from this book that I read: being constantly aware of others and weaving restraint, respect, and consideration into the fabric of this awareness. So to me, civility is kind of good manners. It's I restrain myself when I'm really activated and emotional, but I also respect and I take other people into consideration. And I think, unfortunately for us in healthcare, we've gotten so busy that we don't stop to have conversations. So there's a lot of misinterpretation, there's a lot of assumptions, and I think our communication skills, at least among each other, has really suffered because of that. And we email a lot, and of course that leaves a lot of room for interpretation and misinterpretation. So we need to just be very aware of those things. So I want us to kind of focus a little bit more on effective interactions with other people. So what does that mean? Well, respect for diversity. We need to be team players. Do we demonstrate empathy? Or do we respect people with different views or opinions? How do I manage my own emotions? And how do I communicate assertively? So assertive communication is, I have my own feelings and opinions, but I also respect that you do as well. And so it's not that passive aggressive type of communication, but it's also not that very aggressive. How do we find that happy medium? And to me, that's what assertive communication is. And then continuous improvement means that's what we're doing. We're working to improve ourselves, our own self-awareness. So emotional intelligence is self-awareness, social awareness, and relationship management. And it's so imperative that we are always aware of our surroundings and that we are always trying to improve and interact well in our surroundings. And then how do we give each other feedback? Most of us don't. But how do we have some of these conversations? And then, of course, staying up to date in your field. So, up here where it says demonstrating empathy and actually compassion, I have to tell a lot of people, it seems like every week, don't forget self-compassion. Sometimes we're the hardest on ourselves. So whenever I'm working with someone, the first thing I say is, we have to look in the mirror. We're the only people we can control. We're the only people's behaviors we can change. And sometimes we are not very self-aware. And that's work only we can do. But when have you stopped to just kind of reevaluate, what are my values? What's really important to me? What are my priorities? What are my triggers? Why do I tend to react this way or that way? And really learn a lot about yourself. I did that, I think I was 30, the first time I went to counseling. And I went to counseling kicking and screaming because, of course, I didn't need counseling. And after about 2 sessions, I'm like, whoa, I need counseling. Because we all have issues. We all have things we need to brainstorm about and get feedback on. And I have limited self-awareness. And I think it was really a wise thing for me to do. I feel a lot more self-aware now. So to kind of jump to what's your triggers, we have to ask ourselves, how do I respond to conflict? Well, are you the, I'm not going to say anything, I'm going to bite my lip, I'm just going to let it slide, I'm not going to say anything, I don't want to rock the boat? So that's the silent kind of response. Some people that do this, they stay silent until they can't. So it's like holding a beach ball under the water, and all of a sudden you can't hold it anymore and it explodes. So sometimes these more passive conflict avoidant people hold it in so long, then they just explode on somebody that is just dropped their pen, or something minor because they've been repressing it. But this is not a really good way to respond to conflict. A lot of us who are conflict avoidant think, well, at least I'm not yelling or screaming, so that must be better. It's really not. It's just as harmful to keep your mouth shut sometimes as to have this form of response to conflict. You just get in somebody's face and yell and scream, and it's very reactionary. So neither one of those is really the best way to respond to conflict. Now, I'm not saying that if you bite your lip, sometimes you do, that's appropriate. You have to choose your battles. But when you totally avoid any conflict or try to, it comes out in different ways, maybe passive aggressively. But neither of these is helpful, really, when you're trying to communicate with a colleague. And conflict management is, I have to manage my own emotions because I can't listen to someone else when I'm very activated. So the first rule in conflict management is, what are my emotions and how do I manage them so I can actually listen? Because people want to feel heard. Stephen Covey talks a lot about stimulus and response. And Daniel Goleman, who wrote a lot about emotional intelligence, calls it emotional competence. We have the freedom to choose between a stimulus and a response. And sometimes we think we don't. So if something triggers me, I have the choice how I respond. Now, this is what I'll hear. Sandy, you don't really know. This is just the way I am. This is the way I've always been. This is what we do in my family. We just yell at people and get it off our chest. Or, and I can't control it. And you really have to look at that. You can control it, because think about if I'm driving down the road, I'm late for work, so I'm speeding a little bit, and I see the blue lights. I don't know how y'all respond to that, but it irritates me to death to think I'm about to get pulled over. I'm going to be even later to work. Why is this cop bothering me? Why didn't he go find a bad guy? So I want to let him have it. But boy, when I roll down that window and the cop shows up, I'm like, hello, officer. How are you? I'm not going to yell and scream at him, because I know if I do, I will probably go to jail. So we do have the freedom to choose our responses. And this pause, it's a pause, or this time between your stimulus and response, that's really about restraint. And you can learn how to do that. And, if we look at our brains, our amygdala, that manages emotion and instinct and kind of stress, it fires before our prefrontal cortex. So when we are emotionally activated, that amygdala is on point. I mean, it is the one that's firing. But you don't want it to be the one that controls your response, because generally what comes out of your mouth when you are very activated is probably not going to be a good thing. So we have to find a way to let our prefrontal cortex catch up, because we need that thinking, reasoning part of our brain to catch up. So some colleague has come and has just done something that irritated you, and you really want to just let them have it, but that's probably not going to be productive. How do you buy some time so that your prefrontal cortex can catch up, where that what comes out of your mouth is going to be a little bit more rational, if that makes sense? So you have to decide, when you get activated, what are some things that help me decompress? What can I do to not act on that emotion? And again, even if you're conflict avoidant, you may not be ready to go yell and scream at someone or get loud or kind of biting, but you still have strong emotions about it. So you still have to decompress, even if it's not, you're about to be very reactionary. So some of the ones that I encourage people to try: if you're angry, there's nothing wrong with being angry. A lot of things happen every day that make us angry or cause us to be angry. At least acknowledge it. You know, I feel angry when you blah, blah, blah. I have a surgeon I was working with, and he would get so frustrated in the OR. Well, you don't want to scare the people that are working with you in the OR so that they're frantic and they're going to make a mistake. So he would just stand back from the table, clasp his hands together, and just say, I'm feeling really angry because this instrument wasn't here, or whatever it was. Give me a few minutes. And he just kind of decompressed just by acknowledging it. And then take a time out. Find a way to get out of that situation. That doesn't mean escape. That means you can say, I'm feeling really angry and I don't want to say something I don't mean, so give me a few moments. Or I'm feeling upset about this. Can we come back and talk about it this afternoon? But you always want to circle back around after the timeout. So ask for a timeout, or if you don't want them to know you're upset, then act like your beeper went off or something, you know, just to kind of get yourself out of the situation. Substitute acting out. So I'm a kind of active person. So if I get really distressed, I go find some stairs. There's a lot of stairs around here, and I just walk up and down the stairs until I decompress a little. So if you ever see me going up and down stairs and I'm huffing and puffing, you might want to ask me if I'm angry, but I'm really trying to just calm myself. If you say, well, we are yellers and screamers in my family, and I always feel so much better, just get it out. If you have to do that, go get in your car in the parking lot, lock the door, and then pick up your cell phone like you're talking on it, because if you're screaming and yelling in your car and you're not on the cell phone, people are going to call psychiatry. But put your phone up to your ear, and if you need to yell and scream, just at least yell and scream for a few minutes, and then maybe calm yourself down. Then another thing, I think this came from Stephen Covey, go to the balcony. Like all of a sudden kind of envision what you look like, or what it's going to look like if you really get angry at somebody. Because, you know, if we had a little camera above us that would show us what we look like and how we're responding, we might change our tune and we might act a little more appropriately, because it would probably be embarrassing. So try to envision yourself, okay, what am I looking like right now? Or what is it going to look like when I go and give that person a piece of my mind? Another thing is, you might just surprise the heck out of somebody that's angry with you, or that is cutting or biting, and you might just say, oh, wow, I can see you're very upset. Help me understand what's going on, or what did I do to provoke that? And sometimes it just throws them for a loop, and they will be calmer just because you're actually trying to listen and try to clarify what has gotten them so upset. And then give the benefit of the doubt. You know, assume positive intent. Think about the people we work around. Most of us are here because we care about people. We care about patients. We're trying to do the right thing. And we're not generally here to make somebody miserable. So this is a thing from Crucial Conversations that I think is really helpful. So we all see or hear something, and before we know it or whether we realize it, we kind of tell ourselves a story about it. Well, if that story activates us and we have a strong feeling about it, if we don't get prefrontal cortex involved, we act on that feeling. So that's acting out. We don't want to do that. We want to think out. So you want to find some way to get your prefrontal cortex involved, and then ask yourself, why would a reasonable person do this? So just by asking that question, you're thinking. So if you're activated and I'm asking myself, why would a reasonable person do this? And I'm thinking of some reasons, that's one way to get your prefrontal cortex involved, where you're starting to think and you're not quite as emotional. So let me give you a good example. Let's say Dr. Netto asked me to give a talk before 1,000 people, and he says, Sandy, I need you to give this talk. You're the best one. You're the only one that can do it. And of course, I'm flattered. I'm like, yes, sir, I'll be glad to do it. And so the big day comes, and I'm starting this talk, and he's not there. And I think, oh, okay, I'm sure he'll come in a minute. Halfway through the talk, I mean, I finished the whole half of the talk, he saunters in with a Starbucks coffee. I see him. What is the story? Probably I'm thinking, he doesn't care about this lecture. He was just trying to flatter me just so he had a placeholder to give this talk. He doesn't. So I'm getting my feelings hurt. I'm feeling a little bit angry. Like, he could have at least showed up. He could have respected me. So I'm trying to still give the talk, but now I'm really emotional because I'm upset that the person that asked me to give the talk didn't show up. So he comes up after the talk and he says, Sandy, I'm sorry, I missed the first half of your talk. And I said, yeah, it was the most important part. And he says, oh, I was doing CPR on a visitor out in the hallway. Well, open mouth, insert foot. So again, if I asked instead, if I was thinking, why would a reasonable person do this? I could say he had some patients he had to take care of. He had to get a frozen section done, or, and that way it calms me so that I don't do stupid things like give him a hard time and he was doing CPR on somebody. Another good one, I'm driving to work, I'm late, and somebody cuts me off in traffic, pulls out right in front of me. I'm laying on the horn. They're laying on the horn. So then I'm thinking, why did you pull out in front of me? I'm maybe doing some sign language and saying things, and it just frustrates me, makes me even madder because I'm already late for work. And instead, I might say, why would a reasonable person pull out in front of me? There might be a pregnant person in the back seat. They might have just heard their spouse is in the ER and having chest pain. It doesn't matter what it is, but it's helping me calm down so I can say, oh, I'm not quite as angry at them. And then I think, well, I've pulled out in front of people before. Why do I do that? Because I'm not paying attention. But I sure didn't mean to cause a wreck or make somebody angry, because I'm like waving, I'm so sorry. So I doubt anybody wakes up in the morning and says, I'm going to piss Sandra Frazier off and I'm going to pull out right in front of her. So most people are trying to do the right thing most of the time. So having a little assume positive intent, it will help you, whether the person's intention, we don't know what it was, but I think it's really helped me to do that a lot. To think, why did that nurse call me at 2 a.m.? Why would a reasonable person? Well, there's a lot of reasons you can think. So the goal is not to react, is to respond. So when you take that and realize there are things I have to do to be a part of the conversation, because when there's conflict, you want to stay in dialogue. You want it to still feel safe to disagree, but it's got to feel safe. So how do I give a colleague some feedback? And I call it instructive feedback, because constructive criticism, I mean, I just wince when I hear the word criticism. I don't even like it. So it's not really, I don't know, I don't like that, or let me give you negative feedback. I just like instructive feedback. But when a colleague or a staff member or anybody on your team, there's something that you need to talk about, at least ask yourself what your intention is. Do I want to share this with a person? Do I want to talk to this person because I want to help and improve their behavior, my behavior, our relationship? Or am I wanting to humiliate or manipulate or exact revenge on that person? So that's a good first question to ask yourself. And then, is it the right moment to address whatever this issue is? Am I too upset right now that it probably won't go well? Or does the other person appear to be upset? Are there people around who really don't need to hear this? You know, when I see people in my office, a lot of times they come in and they're so upset because somebody corrected their behavior or brought something to their attention, but it was around a lot of people. And that's so embarrassing and humiliating. And it's hard for them to really accept the feedback when they're so worried about all these people and what are they thinking. And then another thing you might try is asking permission. You know, do you have a minute? Can I share something with you? Because that way, at least it's not, I can't believe you did this or didn't do that, or how could you think that was the right thing to do? So I have found so many times, if I can kind of control, I check myself first, if I can control how I present information, people are much more willing to hear it. And I need feedback, so if I give it well, then people are more likely to give it to me. And when we don't do this, I call it the vicious cycle of vagueness. We don't correct poor performance. We don't reinforce good practice. We don't tell people how to improve. Some people truly are unaware how they impact other people. And so sometimes when I'm coaching people and they talk, oh, this person is so awful and they've hurt me and they've wronged me, they've done blah, blah, blah. And I said, have you told them? Well, no, they know. Maybe they do, maybe they don't. But a lot of times, people can't fix what they don't know. So we make assumptions a lot of times that people know what they've done or that they've hurt us. And a lot of times they're unaware. So making a commitment as faculty to give feedback to our learners, obviously, to each other, to the team, it's the right thing to do. It's kind of coaching. You don't even have to call it for feedback. Call it coaching. And we all need to be coaching and being coached. And I think the more that you decide, oh, I'm going to welcome feedback, the more likely people can accept the feedback that you give. And we can talk about feedback to learners as kind of a whole different topic. I'm kind of focused a little bit more on feedback to each other. But here are two, these are kind of silly formulas, but I guess I can't get away from mnemonics. You know, in medical school, we all had mnemonics, but these two formulas have been helpful to me over the years. If you know that you have to bring something that's may not be pleasant to someone's attention, how do you do it? So if you have a little bit of a template, maybe it'll help. So I use this thing called FIR. You can do it in any order, but obviously FIR is easier to remember. And so I've got to tell this colleague or team member something that not sure how they're going to respond to it, but how do I do it? So first thing is state facts. Then what is the impact on you or the organization? Put a respect statement in there and then make a request. The more you practice this, the quicker you're able to do it. And it also, if you have to do this conversation and you're just thinking about fur, again, it helps you engage that prefrontal cortex. So here's an example. Let's say you have a member of your team who interrupts you constantly. You have a team meeting once a week, and this person always interrupts. And you are so frustrated, and you're like, I don't even know whether I should say anything. They're just so rude. I don't know how they can think that's okay. And I'm just so tired of it. So you're complaining to everybody else and talking behind this person's back. But you're like, no, I'm going to change this. I'm going to at least bring it to their attention. So you want to give very specific information that is factual that they really can't dispute either. So for instance, you would say, George or John or whoever, Susan, I noticed in our weekly meeting, you tend to interrupt me. For instance, last week when I was talking about blah, 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 you interrupted me and started talking about this or made a comment. This week, when I was talking about this topic, you interrupt. So again, you're just giving facts, because if you start with, Susie, you're so rude, or you interrupt me all the time and you're obnoxious, I mean, that's a judgment. So you're just giving the facts. I've noticed that you interrupt me, and give them very specific examples that will be hard for them to dispute. Then you say, the impact it has. So, Susie, when you interrupt, I feel disrespected. I feel like you don't care about what I'm talking about, or our meeting goes longer. What is the impact of that behavior? So you've given the facts. Here's this behavior. This is how it impacts me, either personally or the group. And then you need to give a respect statement somewhere. You might even start with the respect statement. And this has to be true. You can't make up something. If you can't think of anything you respect about the person, just say, I respect the fact that you work at UAB, but it has to be real. So then you say something like, Susie, the things that you say when you interrupt, they're pretty on point. And then what do we usually do? We say, but we've just erased the positive thing we've said. We can't say, you're a hard worker, but. So don't say but, or don't say however. However is just a bigger but. Who needs a bigger but? So you give a respect statement. When you interrupt me, actually the things that you say are very on topic, or they're very important, or whatever. Period. Not but, period. In the future, could you write those down? Could you put them on the agenda? Whatever. And that person may have horrible ADD and they say, oh my gosh, I've been working on this forever. I don't know why it's such a problem. But at least you've given this person the feedback. You're interrupting me. I don't like it. I know that you're a good person. How can we fix this together? So a lot of times we'll get sideways with someone because we haven't even told them what it is that we're struggling with. So I hope that helps you a little bit, just to kind of, when I know I have to have a difficult conversation, let me have something I can rehearse a little bit and I can kind of stay on topic. And then the other one is USA. Basically, it's seek first to understand. everybody wants to feel heard. And I can guarantee you, if you spend a little time trying to understand their point of view first, they're going to be much more likely to listen to your situation. Seek first to understand. So ask questions. Help me understand, why is it that you interrupt me, or why is it difficult for you? And here's my situation. What can we do? So it's more like a negotiation versus a really difficult conflict that just gets bigger. Because when we don't address it, a lot of times you'll see people that don't like each other, and they hadn't for years, and they don't even remember why they don't like each other, because we hold on to it. So for me, a lot of ways when you're frustrated about something, get curious. Ask the questions. Tell me more. What do you mean? Or can you be more specific? So try to understand if there's someone that seems very activated, and try to engage them in a conversation. Here's the other point. Words account for, now this data, I'm not going to argue about it, but it's wherever I got this from, I don't remember, but 7% of the message. It might be a little bit more than that, but what we all know, our words are oftentimes not the most important part of the message. Our tone is very important, and our body language is even more so. So in this day and age of cell phones and emails, particularly emails, tone and body language is not even, we don't know, we don't have that. So our words are everything. And when I'm coaching residents or someone about taking consults on the phone, we work on tone, but they can't see your body language. They don't know if you're smiling because you're just made a joke, or you're serious. And so we really have to be aware of that, because think about it. You can hold a little infant. So you've got this little infant and you're just rocking the infant. You can be saying, you are the ugliest baby. I hate your parents. We can be saying awful things, but if we're saying it in a nice tone and we hate you, you're so ugly. But, it's all in how you present the information. And I get so tickled sometimes. I see some faculty that will say, well, I don't yell and scream at people. You don't have to yell and scream. Your tone and your body language can say it all. So it's looking at the whole package. Then here's the thing. How do we receive feedback? I don't know what it is about those of us in healthcare. We take feedback so personally. Because I guess we're perfectionists, we're overachievers, we don't like to think we didn't do something right. So I try to tell people, just take feedback out of your vocabulary. Say coaching instead. Because think about athletes. They expect feedback, and it's not always nice, and it's not always given in a nice way. But they don't just fall over and I'm quitting because the coach got mad at me. They roll with it, and they're expecting it because they know the coach just wants them to be better and the team to be better. But somehow we've lost that in healthcare, that it's really hard for us because we think it means we're not making an A. And so maybe we should just say, hey, here's a little coaching moment. But receiving coaching, I think a lot of us struggle with that. First, we have to listen to what they're saying. And we need to understand, okay, you said I was not a good team player. Tell me some examples of what makes you think that. What is the behavior? So ask, because I had gotten some feedback, I guess it was last year, that kind of floored me. And so I went to the person and I said, oh my goodness, can you help me understand what in the world did I do that would make you think that I'm not a good team player. So you're looking at, because sometimes I've made the assumption you're not a good team player, but it's just based on behavior and it might be the wrong thing. Acknowledge when they're right. Oh, yeah, sometimes I do that. Or, oh, I can see why you would think that. So think about it, go back, revisit it. I've coached some people that have gotten some performance reviews. They didn't really like what was on there, or residents or fellows with evaluations. And I always tell them, take some time, think about it. Is there some nugget in there that is true that you need to hear, even if it was given in a way you don't like it? But if you don't understand it and it seems like, where did that come from? Go and ask questions. Maybe they misinterpreted it. Maybe they thought it was something that you did and it was somebody else. But it's when we leave things unsaid and we don't check things out is when a lot of relationships go south. So if you want to be proactive and you want to start being a role model, this is what I encourage people to do. Pay attention to your surroundings. How do people respond to you? If we have done something that has frustrated someone, if you just watch how they respond, we generally can tell. If I've hurt someone's feelings, if they're angry, something's going to change. So sometimes you have to say, and I do this sometimes with people I see in my office, we're talking and all of a sudden their facial expression changes. I'm like, oh, wait, what just happened? You seem angry, you seem sad. Did I say something? Did something just get triggered? And then listen. Interestingly, when you think about it, the word listen, the same letters are in the word silent. So sometimes we have got to be silent and give people our attention. And then another thing, just acknowledge other people. Do you know the people that work with you? Do you know this technician? Do you know this person that's an administrative assistant? And just acknowledge them. Good morning, Sharon. Good morning, Ted, whatever. And then how many of us really ask for specific feedback? A lot of us don't because we're afraid what is going to happen. And so don't say, how did I do today? Because most people are going to say, fine. Well, that's not helpful to you. So you might have to say, how did I do in that conversation with that referral source? How did I prepare that slide? Or, so ask for very specific feedback. What did I do well? What are some things I can improve on? And as you role model that, it makes other people more likely to do the same thing. Another great technique is feed forward. So let's say I need to learn to listen better. I can say, I'm going to ask a few people that I know that I think are good listeners. I'm just going to go say, Marissa, can you just tell me one or two things I can do to be a better listener? And she said, okay, well, put your cell phone away and make eye contact. Oh, great. Thank you very much. And then I'll leave. It's not a debate. It's not this long exchange. I'm just asking for tips. What that does is it shows that I know I have things to improve on, and I'm trying to do that. Again, think how that would affect, let's say, a fellow. If you went to the fellow and you said, I'm working on listening better. What's a couple of things you think I could do? And the fellow says something, okay, thanks. They're going to think, wow, they do realize they're not a good listener, and they're trying to do something about it. And then apologize quickly. We're not perfect. There are going to be interactions that don't go well. We know it. We usually know. So apologize quickly, because people have a lot of grace if they think that you noticed that something that you did or said was not kind. It's when you don't apologize, they assume that you don't care. And so let's say you lose your temper a little bit, you get a little short with someone, and you realize it, but you never go back and say, I just need to apologize. I don't think that came out the way I wanted it to. Then they just assume you don't care and that you didn't even recognize that you stepped on their toes. So always be willing to just, I'm so sorry. I think that came across the wrong way. Or I'm sorry, I'm a little frustrated today. I sometimes come into work and I'll say, I'm in a bad mood. My husband and I just had a little tiff. So I'm apologizing before I say or do anything, but just give me a little bit of grace until I can get better this morning, And then always praise people. We don't do that well in healthcare. When is the last time we said, that was such a good job. I love the way you, and again, specific. I love the way you talk to that patient. I love the way that you, I just like my administrative associate responded to someone in an email and copied me. And I sent an email to her and I said, that was a beautiful response to that email because I so appreciated how kind she was in that response. She didn't have to be. And so praise people, appreciate people. And so people really learn from us how we want to be treated. So think about it. People learn from us how we want to be treated. And if you start doing some proactive things and start focusing on being a role model, a positive role model, it just makes life better and work environment better. We're all role models. We can be positive or negative ones, but I think these things will help you some. So just to recap, ask yourself if there's something you need to address, what will be the outcome if I don't address it? Because you may not want to address it. But what if you don't? Because what do us conflict avoiders do? We hope somebody else will address it. But what's going to be the outcome? Again, a lot of times it just means poor behavior continues. I've got to manage my emotions. I need to focus on the problem, not attack the person. Because most people around us, smart people, good people with a lot of good intentions. And then assume positive intent. We judge people, we look at our own intentions and we know them. And so like when I pull out in front of somebody, I didn't intend to, I wasn't trying to irritate someone. They don't know that's not my intention. So we judge people on how they impact us, but assume positive intent. Be curious, practice active listening, and focus on communicating in a respectful, civil manner that acknowledges other people's opinions and feelings as just as valid as yours. So finally, a couple of references. All of these I think are really good books that I probably took some things from. I'm a book person, I like to read. And here is my information. And I see anybody in the under UAB medicine umbrella, MD, PhD, faculty, fellows, residents, medical students, in a confidential setting, I don't keep electronic records, I don't bill people. I'm kind of just, I think it's kind of a triage person. If there's something going on personally or professionally, let's talk about it. So maybe I can at least direct you to right people that can help you if I can't. But I care about people in this organization. UAB's been very good to me, and I love coming to work or virtually coming to work. And I want people around me to feel that way because we take better care of patients when that happens. So I hope this was a little bit helpful. It's just hard to impart any wisdom to people who are already very wise. But please don't hesitate to reach out to me at any time. We might have a few minutes if there's any questions or confessions or or anything. So I'll leave the floor open. Let me see, I'll stop sharing.
This was wonderful. Thank you very much. I know I learned a lot. I'm not going to interrupt people during the meetings. I always I'm going to even praise more, but not over praise. It's amazing. And I think that very last slide is very important. Please, all of us can use some advice at certain times, and knowing that this is very confidential and we have such an expert that we can reach, please do that.
I have to tell you, Sandy, that when somebody cuts me off in traffic, after I get mad, I think that they're bleeding to death and they're coming to UAB. And then the next thing I think is, we have enough blood for them. Okay, it's okay.
That's right.
It's just, you think of the so, but I do get mad at first, but then I try to think somebody may be sick in that car, and so
because
I'm glad that my brakes worked.
It'll ruin your day if you stay angry, you know. And my luck is I would run into that person that I've given sign language to, and like, oh, you're the one that shot, you know. So I just decide, let me give the benefit of the doubt so I don't get myself in trouble.
I still get very mad, so I have a long way to go.
We're all a work in progress, for sure.
This was excellent. Thank you very much.
Thank you for asking me. I hope you all have a good rest of the week and weekend.